I'm Dr. Dean Peppard, and I'd like to thank you for taking a moment to watch this video. In this video, we're going to talk about the 3 types of care that chiropractors offer. I'd like you to look at my chart here, and you can see that it's broken down into 3 types of care. We have initial intensive care, we have rehabilitative type of a care, and we have maintenance type of a care. Initial intensive care is care that is relief care. Patients come in with an obvious symptom and they want to feel better from that symptom. Generally, this type of care takes anywhere from 4 to 12 visits, depending on a lot of factors. For example, a patient who's younger is probably going to be on the shorter end. If they don't have any arthritis, it'll be the shorter end. Maybe the person had another bone weakening disease, and that might take them on the longer end. So this varies a little bit, but anywhere from about 4 to 12 visits. In rehabilitative type of a care, this can take anywhere from a few weeks to possibly a few months. And the reason that we say a few weeks to a few months is it depends on what the x-rays look like. So we're going to take a look at some x-rays and show you what types of spines we see. If you can see my pen, I'm going to point to each phase and then we'll talk just a bit about it. This is what a side view of a normal neck would look like. Notice there's a nice backwards curve to it. As a spine undergoes a misalignment, it actually loses its curve. So here it flattens out just a little bit. And if that spine were to continue to degenerate, we would see that the joint spaces would actually decrease and the integrity of the bone actually collapses. If that gets untreated and gets really bad, it can actually fuse. So, a spine that is in normal condition is probably not going to need too much care. A spine that is in a phase 2 type of a position or phase 3, these are spines that often take many weeks or possibly a few months to recover from. Oftentimes, we can get a spine in this phase back to this phase if the patient desires to do so. It does take a lot of chiropractic care and a lot of exercise at home. The next phase is maintenance care. Maintenance care is care that we offer to patients once they have completed either initial intensive care and rehabilitative care, or if they just want relief care and their spine is in good condition. For maintenance care, we like to recommend it's anywhere from once a week to maybe once every 6 weeks. Personally, I get adjusted about every 3 weeks, and that seems to be a good interval for me. Think of this type of a care as kind of like a preventative type of a care. Much like a dentist recommends that you go in periodically and you get your teeth cleaned, and for me, I do that every 6 months. This is the similar type of a care that we would offer as chiropractors for the spine. So, in maintenance care, this is elective care and care that is designed to help your spine stay well. Well, that concludes the video presentation that describes the 3 types of care that we offer, and hopefully that was informative for you and will help you better understand why we recommend the care that we do. Thanks again for taking a moment of your time to take a look at the video. We really appreciate it, and we'll see you next time. Thanks again for looking at the video. Thanks again for taking a moment to look at the video.
I'm sorry. I'm sorry. Okay.